Hello, my name is Michael Mahoney. I am a clinical hypnotherapist based at Guardian Medical Centre in Warrington, Cheshire, England. I have specialised in helping sufferers of irritable bowel syndrome, or IBS as it is more commonly known, since 1993. During this time I have completed medical research projects using hypnotherapy processes. I have conducted patient trials and written articles for numerous publications. Clinical hypnotherapy is not stage hypnosis. It uses hypnosis as a therapy to deal with whatever is presented. You are listening to me now because you either want to know more about IBS so that you can support someone that you care for who has that condition, or perhaps you're becoming intolerant or frustrated with someone who has IBS, or they have suggested that you listen so that they know that you are aware of how the condition affects people. This explanation is in everyday easy to understand language. It is not much longer than perhaps 20 minutes. That's all. This is time out that you should try and take because it will help you to understand the condition. The first thing to understand is that IBS is no respecter of age, social background or culture. 1 in 5 of the population will have IBS at some time in their lives. It can strike anyone. The fact that non-IBS sufferers are non-sufferers at the moment does not mean that they will not develop it later on. A hard fact of life, but a fact all the same. The symptoms of IBS are wide and varied. Diarrhea that is sudden, watery and explosive, often with no warning or opportunity to reach the toilet. Constipation that can at times hospitalise sufferers, or a combination between the two. In addition, many sufferers have sharp stabbing pains, bloating that can take the dress or the waist size of sufferers up 2 sizes, tenderness of the abdomen, upper stomach pain, pains in the back passage, nausea, pain and discomfort during and after intercourse, sometimes for days afterwards. Men may be unable to obtain or maintain an erection. There is often feelings of the bowel or the bladder not being quite empty that can lead to straining. Also lots of flatulence, belching, mucus or wetness in the back passage, headaches, lack of sex drive, disturbed sleep and many other symptoms. IBS is a functional disorder. That means that there is no organic problem that can be observed at present by the medical profession. There are no ulcers or tears. A functional disorder means that the way that the digestive system operates, called motility or peristalsis, is functioning incorrectly. There is a process called the brain-gut connection, and that there is evidence to suggest that there is a direct link between the thoughts of the brain to the functioning of the digestive system. It is helpful to understand that people who have been diagnosed with IBS have been through medical procedures that are not pleasant. There is no cure for IBS. The medical profession and the drug companies are working very hard to find one. However, hypnotherapy has been used for many years, successfully, to reduce symptoms and frequency of presentation. Some of the procedures that the IBS sufferer will have gone through will be mentioned now. X-rays of the abdomen, which are pretty much self-explanatory. An endoscopy. It is a procedure that can be carried out from the top end to inspect the esophagus, the stomach and the duodenum, or it can be carried out from the rear to view the entire large intestine and even the last part of the small intestine. It is carried out with a long flexible tubular endoscope which is between 9 and 12 millimeters in diameter. A gastroscopy. The endoscope is inserted through the mouth and introduced via the esophagus and the stomach as far as the duodenum. It is carried out on an empty stomach. It is painless. There may be some discomfort on the back of the throat and slight pressure in the stomach. The colonoscopy. The endoscope is inserted into the rear passage and advanced through the entire large intestine as far as the small intestine. The patient has no food for 24 hours. Laxatives must be taken, or intensive irrigation of the intestine is carried out. Colonoscopy, which isn't always painless. Painkillers and tranquilizer injections are sometimes used to reduce discomfort. A rectoscopy, which is inserted into the rectum and the first 15 to 20 centimeters of the intestine are inspected. It is the most simplest of procedures, the least uncomfortable. The rectum is irrigated using a small amount of fluid. Tissue specimens can be taken if needed. Invariably, there will always be a rectal examination. First, the patient will need to strip from the waist down and lie on the examination couch. While lying on their back, the doctor will feel the abdomen, searching for tender areas or lumps. The patient then turns onto their left side and draws up the knees. This helps to relax the anal muscles. It also helps if you breathe deeply and slowly. The doctor will inspect the outside of the anal passage and then place a lubricated gloved finger into the back passage. This should only take a minute or two. Although some slight discomfort may be felt, the procedure should not be painful, and any discomfort will be minimized if the patient relaxes. Any discomfort, however, should be reported to the doctor. The proctoscopy. A small tube with a light on the end is inserted into the back passage, which allows a visual inspection of the anal canal and lower rectum. The tube may feel cold but should not hurt. The sigmoidoscopy. A sigmoidoscopy is similar to a proctoscopy, but the tube is longer so that the doctor can see the entire rectum. During examination, air is pumped into the bowel. The patient may feel the need to pass wind, but don't worry. The doctor expects this. The procedure should take 2 or 3 minutes. A barium enema. A barium enema is an X-ray procedure during which a thick, white fluid, which is barium sulfate, is introduced into the colon via a tube. Some air will also be passed through it, and the patient will be asked to change position so that the barium moves around the colon. The barium will then be drained out, and the patient goes to the toilet and gets rid of the remaining fluid. Having had some or all of these unpleasant, embarrassing and intrusive tests, the sufferer is told it's IBS and there's nothing that the medical profession can do. That's right. The medical profession do not have a cure for this condition. The measures that the medical profession can take are limited to prescribing bulking agents, laxatives or painkillers. There is much research going on at present, but to date the drug companies do not have the answer either. So the IBS sufferer has to put up with the pain, discomfort, uncertainty and embarrassment, not for a few days or weeks or months, but can suffer these symptoms for years. And because of this, stress, anxiety and in some people forms of depression can develop. Some people too may become agoraphobic or develop social phobia. The medical profession knows that the condition is not life-threatening. However, it can have a huge impact on the quality of life of the sufferer. Also, it will affect those in the sufferer's social or family circles. Holidays being limited, days out being cancelled or not even planned, school visiting, works outings, presentations being avoided or dreaded, and much more. IBS can seriously affect the quality of life for the sufferer and those around them. Self-confidence is lowered, self-esteem is lowered, and the ability to see things in perspective can be distorted. The actions and habits of the sufferer can change too. Routines can develop, visiting the toilet several times before leaving home. Some people may stop going out. Some will develop routines where they can frequently stop and visit the toilet en route. In addition to all this, remember the IBS sufferer has to try and continue with everyday issues of life. Whether they are family, whether they are going to work or to college or socialising. Hypnotherapy, however, has a long and researched history of helping IBS sufferers. This works on the basis of the brain-gut connection mentioned earlier. However, it does take time to retrain the subconscious to change the IBS thoughts. The IBS audio program 100 is designed specifically for the IBS condition. The website www.ibsaudioprogram.com contains lots of information, links that will help not only the IBS sufferer, but also the family and loved ones. The IBS sufferer needs as much support and understanding as can be given. For the partner of the IBS sufferer, life can be frustrating. The sufferer can be annoying and seem selfish or self-centered. However, by the time that you have finished listening to this recording, you will have a better understanding of what the sufferer is going through. Having worked with many IBS sufferers over the years, there is a general trend of concern that sufferers mention during the consultations. Things like, IBS can affect every aspect of the sufferer's life. Stress only exacerbates the condition. IBS is not all in the mind. The pain and the anguish it causes are real, just like the symptoms. Often there is a fear felt about being in public places and situations. As a partner, it is important to help the sufferer find solutions and mechanisms to cope, to deal with the fear. Otherwise, there is a risk that the sufferer may retreat into further isolation. Frustration with living with a disorder that can vary in severity from mild discomfort to deep despair. Triggers are another concern. Triggers are those things that can be tolerated one day and not the next, as with some foods, for example. Also, there is frustration with the medical profession, who may advise to be less stressed and things will get better. To learn to relax and reduce stress when feeling the way IBS makes people feel is a task in its own right. No energy and listless. It would help when this is the case that other members of the family could pitch in and help. IBS and working. These two cause problems for many sufferers. Lack of ability to leave the workplace, the office or factory or wherever. The job the sufferer does restricts ability to feel comfortable too. Teachers can't just leave the classroom easily, and there are many other examples. It is important that the partner of the IBS sufferer remembers the IBS. IBS sufferers will not always complain that they are in discomfort or pain. It does not mean that the discomfort or pain is not there. some partners or families tend to ignore or refuse to believe just how serious and debilitating this condition is. The more it is ignored or dismissed, the more stress will be caused. The condition is uncertain. If someone has a heart condition, they can take pills to manage it. With IBS, medication rarely helps to achieve any significant level of relief. So the thoughts quite naturally are, when will it strike? Where will I be? How can I plan to do this or to do that? The IBS thoughts are always there. The fear of losing control and the embarrassment of it is often deep-seated. IBS sufferers often have guilt that they can't do what they should do around the house or at work or study. So it is important that as the partner of an IBS sufferer, you are as patient and understanding and tolerant and loving as you can be. And of course it isn't always easy. There are times when you feel low and need support yourself, and perhaps feel that you are not getting the support you deserve. IBS is not easy for the sufferer or the family. However, it is not all bleak. The medical profession are working hard on a solution. My own profession is developing processes and procedures and trialling them. The IBS audio program 100 has helped many sufferers around the world, and I am constantly looking for new ways to manage IBS. And I am doing further trials at this very moment. Imagine having stomach flu, a bad bout of gastroenteritis which after a few days of pain and diarrhea and nausea, we recover to get on with our daily lives. We remember the pain and are grateful that it is past. Now imagine it is not passing, and going to the doctors and having the medical procedures of cameras inserted down your throat and into your back passage, only then to be told there is nothing that they can do. You are perhaps now getting a small indication of how the IBS sufferer has to live their lives. Add to this the frustration, the guilt, the anxiety, the soreness and tenderness that many IBS sufferers feel, and you are closer to understanding the condition. However, as I said earlier, it is not all bleak. With your support and your partner's determination to get through the difficult days of IBS, together with understanding on both sides, not only will you feel that you are supporting your partner better, but supporting them in a way that is really meaningful and effective in helping to reduce the negative emotions which compound the IBS condition. Thank you for listening to me, and thank you for trying to understand. Your partner will be grateful too. Goodbye.